Hey guys, what's up? This is Haley from RN New Grads, and today in this video I am going to be giving reports to the camera or to whoever's on the other side of the camera so you guys can practice on your skills of taking reports so you can feel more comfortable doing it in the hospital in real life, real time with real patients. Okay, so this is a made-up patient. None of this correlates with a specific patient, so no HIPAA violations or anything like that. So let's go ahead and get started. Grab a pen and paper and let's do it. So we have John Snow. He is a 45-year-old male, full code, room 701, admitted on 11/2. He is a tele patient. General diet. Doctor for him today was Dr. Black. He is allergic to codeine and penicillin. He came in for alcohol intoxication and came in with tachycardia. He has a history of urinary retention, hypertension, COPD, CHF, AFib, depression, and alcohol intoxication. He is ANO times 3 to 4. Cardiac-wise, he is normal sinus rhythm to sinus tach. Previously, he was on a cardizem drip, but he is no longer on a cardizem drip. He's on room air. Lung sounds, he has expiratory wheezes. He's on the continuous pulse ox. He is voiding spontaneously without difficulty. Last BM was on the 1st per the patient. He has a left forearm, saline locked. Skin's intact. Mobility-wise, he is independent and he does have PT orders in. No complaints of pain. PRN medications, he has Norco, Ativan, and Cardizem. The plan for him is to find placement and case management will be working on that. Okay, so I just gave report of a fairly simple of a fairly simple patient. Hopefully I didn't go too fast and you guys were able to write everything that you wanted to down. I did leave some stuff out that I would normally include in the report just because now I want you guys to go back, whether you have to listen to it again or you already know the questions that you would ask at the end of report to the nurse giving you report in order to best have an understanding of the patient. So if you now want to take the time to rewind, watch it again, or if you have your questions, write your questions down. I'll go over the questions that I would have answered or if I would have asked if I was the nurse getting reports. So relating to his alcohol intoxication, which is why he came in the first place, I would ask if we are still doing CWA. CWA is just something that you need to chart. It's very common for alcohol intoxications. You have to do it every 4 hours. So that would be something that I would want to know. Again, it's not the most, there'll be orders. You know, naturally you will go over the orders when you're going through the patient's chart, but it's an easy answer that the nurse should be able to answer rather quickly. I would also ask, since he does have expiratory wheezes, I would ask if he does have any respiratory treatments, whether it be PRN or scheduled. If he didn't, you know, that's something that I would write on my to-do list to talk to the doctor about. You know, obviously if he does have expiratory wheezes, he probably could benefit from RT treatment. In report, when I did tell you he was previously on a cardizem drip, I never said why. So that would be something important to want to ask, why he was on a cardizem drip, because you know, that's obviously something that's very important for the patient's health and something that you definitely need to be knowledgeable about. And I believe that is about all the questions that I would ask. If you have any comments, questions about this, ideas that you want me to go over, or patients that you want me to make up for the next video, or if you think that this video was helpful for you at all in any way, hit that like button, comment below, let me know your thoughts, concerns, questions, whatever. I'm very open-minded about this. This is my first video, and I guess we will see where this takes us from here. I hope you guys enjoyed it, and I'll see you next time.